Joining me now is Dr. Demetre Daskalakis, one of the CDC officials who resigned in protest earlier this week. Dr. Daskalakis, thank you so much for joining me. I really appreciate it.
My pleasure. Thank you so much for having me.
Well, we appreciate having your perspective today, and you were at the CDC for years. So this undoubtedly was an incredibly difficult decision for you to make. What made you want to ultimately resign?
Yeah, so I was at CDC for about 5 years and in governmental public health for over 10. My guiding principles are that I'm a physician, and as a physician, I take the Hippocratic Oath, and that oath is to first do no harm. And in the recent history at CDC, have seen it slowly being transformed into a weaponized organization that is being designed really to achieve ideological goals rather than to deliver important public health messaging and services to support the health of people in America and, frankly, the globe. When I feel that I'm going to do harm, I have to make good on my oath, the thing that I did when I graduated from medical school, and the time had come. That, along with the fact that it seemed as if there was no way to have scientific leadership at CDC be maintained if Susan Menarez wasn't there anymore. That really meant for me that there was no way to really maintain the firewall between ideology and science. And so I think now it's inevitable that science will be contaminated by ideology unless people take our wake-up call here, our red flag, to really try to make a change now.
You know, you said in your resignation letter, and I'll read just a little bit of it, that HHS policies do not reflect scientific reality, echoing what you've just said here. But my question for you, why not stay and fight if you think this void with Susan Menarez could be so devastating to the public's health? Why not stay and fight for public health?
Trust me, if I thought that there was a fight that I could fight in there, I would have stayed. And the reality is that there is now an irresistible force that is going to make it impossible for CDC to maintain the validity of its science against ideology, especially in the vaccine space, given what I'm seeing from HHS leadership. I stayed there during some really complicated times under the current secretary. I managed to sort of toe the line and make sure that we were able to end a measles outbreak in the US, the largest in the history since elimination, by really towing the line and making sure vaccines were first, but that we really created communication and strategies that also aligned to his vision. The list, we received a directive about changing COVID-19 vaccine for children and for pregnant women, and we were able to do that in a way that maintained access. I don't see a way out. If there are documents that make someone on the ACIP who doesn't really demonstrate any experience or belief in science, as far as I can see, makes them my boss and is the person who can direct the staff over and above the director of the CDC, and whose job it is to prevent CDC bias from entering the work group that will make very important recommendations to the Advisory Committee for Immunization Practices when that bias does not exist. What that means, rather than prevent CDC bias, is allow their bias to influence the science. And there's no way out when it is, in fact, codified in policy.
So just the bottom line here, do you believe the public will be able to trust the information coming out of the CDC moving forward?
Yeah, I mean, I really hope that the answer is yes, but I don't think that it's going to be possible, especially in the vaccine space. I think that there has already been some attacks that are making me very concerned. Of course, there's some physical attacks that we can talk about that were related to vaccine mis and disinformation. But I think that there are also attacks around things that have already been litigated that will really, I think, erode trust in vaccines, really interventions that have prevented millions of diseases that have allowed us to have healthy children. And so I do think that that's not the source that you should go to right now. You should cross-check it with your clinician. Talk to your doctor, talk to your pharmacist, see how they're interacting with their professional organizations. Ask them, what do you think about the Pediatric Association's guidelines around COVID vaccines and maybe other vaccines? I think it's really time to take this with a grain of salt, because I think that the data that's going to be used to make these decisions is going to be compromised, because there's no way that it is going to be protected from ideology.
Just to boil down what you're saying.
Unless we make a change, unless there's a change.
Well, and to boil down what you're saying, Secretary Kennedy has long pushed the disputed claim that there's a link between vaccines for children and autism. This has been debunked by the science for the past more than 2 decades now. Is that the crux of your concern? And is that the crux of the argument with Susan Menares, that there's going to be an attempt to push that type of policy forward, an ideology forward?
I mean, let's make a list. The secretary went on a video and said that that mRNA vaccines didn't do anything in the pandemic, and they're the most dangerous vaccines known to humanity. That's wrong. That's untrue. The vaccines for COVID helped end the pandemic, and their safety track record is strong. There are safety issues. Yes, people do have adverse events. There's no such thing as a zero-risk vaccine, nor is there such a thing as a 100% effective vaccine. So that's number one. We can also talk about the fact that, there is, I think that we have signals that there's going to be retrofitting of data or analyses of data that really aren't based in any good scientific methods, that are going to come to a conclusion that something is causing autism as well as other diseases related to vaccines. I think alum is going to be pointed at. That's another part of the vaccine that makes sure that it causes the immune system to react appropriately to protect people from the pathogen that they're being vaccinated against. They're going to have a story about alum. They already had a story about thimerosal that led to the removal of thimerosal from the 4% of influenza vaccines that had it. That's not a very big win. Based on science that is really debunked, the FDA website right now has a website that is very clear, showing that thimerosal, that preservative, does not have any adverse events associated with it, especially in the space of autism and other neurocognitive issues. Nevertheless, because there's a half-truth somewhere in there, that maybe it's great to prevent having people being exposed to anything extra that they don't need, we get to the place where a hunch is enough to remove a vaccine from the market. That is not a good precedent.
Let me ask you about comments that you recently made, in which you said that Secretary Kennedy has never been briefed by your group on COVID, measles, other viruses. Can you explain that? Did you reach out to Secretary Kennedy? Were briefings offered to him? Did he refuse them? What exactly does it mean that Secretary Kennedy was never briefed? What did that look like?
Yeah, I'll start by saying I've never met Secretary Kennedy. I wasn't there when he visited CDC after the attack, the gun attack on CDC, through his staff, some of which have been fired, others who are still there. Every time I met with them in any space, I said, we would love to brief the secretary, especially on topics that are important and are higher profile and important to the health of America. I thought that it was great to offer a briefing on measles. That was not something that we were ever allowed to do. I offered briefings on H5N1, on bird flu. That was not taken up. I said, we're happy to talk about vaccines in general. And that was through some of the folks that work in his office of the secretary. I offered those at senior leader meetings at CDC. There were many people present. You can ask Dr. Howry, you can ask Dr. Jernigan, and it was crickets. We heard nothing back. So he has never been briefed by any of the CDC experts on any of these diseases, specifically vaccine preventable diseases, which seem to be a pretty significant piece of his agenda.
What do you think are the implications of Secretary Kennedy never having been briefed on a range of different diseases that could be prevented by vaccines?
Yeah, I mean, I think that the question that everyone should be asking is, if you're not being briefed by your experts, who's briefing you? Where are you getting your information? I think I gave the example of what we heard about mRNA vaccines from the secretary, that they didn't help anything in the pandemic and that they were the most dangerous vaccine known to humanity. But we also had the secretary saying that the measles, mumps, rubella vaccine caused more harm than it does good. We also heard that from him that it doesn't last long enough, or it has that there's waning immunity, and that's contrary to anything that our experts would say to him. So I don't know where he's getting that information. If I were still there, I would offer in the same spirit. I would love to give him the opportunity to hear from the people who are the world experts. Every country in the world calls us to learn about measles, to learn about COVID, to learn about these vaccine and preventable diseases. We are the leaders in the world. It's strange that our own secretary won't listen to our experts and says it very clearly. Don't believe the experts.
Well, let me ask you, as we look forward, the president has tapped HHS Deputy Secretary Jim O'Neill to be the acting CDC director. What do you make of that decision, that choice? Just as I did with the secretary, I always give people, really the benefit of the doubt and a chance. And I'll just put us in a time machine. When the secretary started, he gave an address to HHS saying that he was coming in with no preconceived notions and wanted us to approach him in the same way. And I did that, trying to sort of meld our science with what his vision is. And I'll say the same with Jim O'Neill. I don't know him. I'm not familiar with his resume. I understand that he is not a scientist, but has some experience in governmental public health at HHS. So I hope that he, in those experiences, understands the importance of engaging with scientists and really supporting the science so that America's health can be optimized, so that people know what to do with the best science, so they don't get sick from any of these infections. And though I talk about infectious diseases, CDC does a lot more. Follow the science on how to prevent overdose, follow the science on how to prevent injury, follow the science on how to prevent chronic diseases. And my hope is that someone who's a leader of large organizations, which he has been, will understand that the best thing to do is listen to your experts. If I became the CEO of a hedge fund, I would definitely want his advice. Very quickly, before I let you go, Senator Bill Cassidy, who is a doctor, expressed real concern over the firing of Susan Menares. And he said, quote, "I'm committed to the president's vision, which is why the HELP Committee will conduct oversight." Do you have confidence that Congress can conduct effective oversight over the decision to fire Susan Menares?
So I'm an American, and I believe in the power of our system. I believe in the power of the people that we elect. I believe in their vision, and I believe in their ability to make a change. So I'm here with no job, raising a red flag in the hope that those red flags really inspire the right action from our elected officials. So again, just like I walked in optimistic with the secretary, and I'm optimistic with the acting director of CDC, I'm going to be optimistic as well that these folks will do the right thing and make sure that they protect the health of America rather than focusing on ideologies or other agendas.
All right. Dr. Demetre Daskalakis, thank you so much for joining us and sharing your perspective. We really appreciate it.
Thank you so much for having me. Have a nice day.
You too.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.